Hi, friends, and welcome to another episode of your Bish Therapist podcast. Today, I am going to be talking about, as promised, the topics of neurodivergence and neurodiversity. In addition to that, I'm going to be talking about all of the conditions that are most commonly associated with being neurodivergent, specifically ADD, ADHD, ASD spectrum. I am going to, share the important thing to know about why I'm doing this is last week I got involved in a drama that wasn't mine, with Tamra's announcement and then retraction and apologies, etc. And so my goal is always to educate. That is what I believe that I am here to do. However, at the end of the day, I have to be okay with putting my head on my pillow and going to sleep. And am I okay with how I behaved that day? I have a level of morals that, when I'm dealing with a chronic cancer, for me, I live every day as like it really matters. And I want to make sure that I go to bed at night and lay my head on the pillow knowing that I followed my morals and values. That's kind of how I am. And so I understand that there were lots of varied responses about me deleting my post. But one thing that I'm going to be clear about today is that I'm never going to stop educating. So that's what this episode is to do today. I need to start this podcast by saying on the topic of neurodivergence and neurodiversity, which includes autism spectrum disorder, ADD, ADHD, and other neurological and genetic disorders. Okay. This is a vast and complex topic which requires specialized education. In my opinion, the best and most complete education comes from those living with the diagnoses, either as a patient or a caregiver. However, there are medical professionals who are so important in the process, and their education must be specialized and very well lived and experienced in their training. So, for example, what people like about me is that I'm a professional and I'm a patient. It's rare to find that these days. In fact, I get a lot of messages about, are you still practicing? I just feel like you get it. And so while I appreciate it, I want to acknowledge that, in the field, the best we can hope for is someone who is willing to listen and willing to go with us on our journey. Okay. In my experience, I've had a lot of experience seeking help and providing help in the mental health and the healthcare system world. Okay. I've done a lot of that. And so my anecdotal experiences tell me that you ultimately want someone who's properly trained to diagnose this, who I'm specifically a psychiatrist, a neuropsychologist, I'm going to list all of the people who are supposed to be diagnosing this, because one of the main questions was, can a therapist diagnose this? And the answer is yes and no. And I know that's confusing, but I'm going to clarify that. But my point is that all the people involved in assisting somebody with these diagnoses, and it does take a village. It takes mental health care professionals, physical health care professionals. Quite often with children, the first person to assist with getting an assessment or referral is a primary care physician. OTs, PTs, speech language pathologists. It does take a village to assist these folks. And that needs to be said. It needs to be acknowledged, but it also needs to be understood that the best people to help are people who genuinely want to help, who genuinely have an interest in helping, and who are educated and able to do that. Okay, so what I will say is, as a therapist, I understood clinical depression in a different way once I experienced it as an adult. I experienced depression throughout my life as a young person, as a teenager. What am I, 100 years old as a young person? Anyway, those little whippersnappers, But when I was younger and I experienced it, and being an adult and experiencing it were two different experiences. And so the same thing happens with neurodiversity, is that adults experience things differently than children and teens do. And so I think that although I didn't totally understand, there was a piece of clinical depression missing. And when I experienced it, it just locked in the puzzle. It just completely locked it in. I understood this from top to tail, inside and out. But we don't always have to have healthcare professionals who know what it is to experience something, right? When you're going in to get, my oncologist, they don't have to have cancer to be experts and to help me, right? And so it's more so about making sure the person or people that you get to understand your humanity and are people first. I've been to a lot of doctors, both mental health and physical health, that their bedside manner is awful. Some people don't need a bedside manner. Some people do. And for me personally, I'm such a unicorn of a person that I don't even care about bedside manner. Just be good at what you're doing. But my point is that this topic is so vast and so complex that that cannot be understated. There's tons of research, tons of statistics, tons of studies, right? And so all therapists have varied experiences and specialties, and admittedly, this is not mine. But I'm an advocate, I'm an educator, and I'm also not claiming to know more than I know. I think that's an important thing with healthcare providers, is like, the ego needs to be out of it in terms of we only know what we know, right? So my point in this long rambling intro is that I basically wrote a research paper about this. I have resources. I did the research. I did the work. And I am going to be, I connected with someone online who has a son who is a nonverbal on the ASD spectrum. I'm talking about this from a perspective of, research and studies and statistics, but I also want to get someone on the show who lives that experience, because again, I believe that they are the real experts. I'm very excited to try to educate and share experiences and perspectives about this, because what happened last week, it's not about Tamara. It's about the people who felt misunderstood and not heard and not listened to and judged and all that stuff. And so that's why we're here today. Neurodiversity goes beyond differences and challenges the idea that typical brain functioning is superior. Neurodivergent individuals bring valuable strengths like hyperfocus, intense empathy, or unique spatial reasoning. So neurodiversity flips the script on neurodivergence, or on the thought that our brains working differently is somehow a disorder or a problem. And neurodiversity spins that on its head and says, we all think differently. And I love that, because I couldn't agree more. I always talk about how everyone is unique. People are like snowflakes. And the idea behind neurodiversity is just that, societally, we have gone by this bell curve of what's quote unquote normal and what's quote unquote not. But the problem with that bell curve is we were ignoring a lot of the things, like autism spectrum disorder and, all of these issues. People's brains have always worked differently. It's just, when we were growing up in the 80s, 60s, 70s, 80s, 90s, that was not acceptable. It was like, that was a time of you were quote unquote normal. You had to be this, you had to be that. And so the idea of neurodiversity says some of the greatest minds in our world have been people who have been neurodivergent or neurodiverse. Okay. And in fact, the term neurodiversity was coined by a sociologist named Judy Singer, who also happened to be autistic. In 1997, she recognized that everyone's brain develops in a unique way. Now, keep this in mind. 1997 was first time this phrase of neurodiversity was coined, and it was by a sociologist who was autistic. And in the 90s, I imagine she had to crawl through mud and broken glass to get people to listen to her and to understand that her brain was so valuable too. Because this beautiful person, Judy, who coined this term, has given us a framework from which we now have to work off of. And so to Judy Singer, I salute you. So neurodiversity has two main categories, neurotypical and neurodivergent. Okay. Neurotypical is individuals who process information, behave, and develop in ways considered typical by societal standards, which I just explained how that can be problematic. Okay. They may not even realize their brain function is different as it aligns with what's expected. So these are people who are just born with brains that just work really well in the way that they're supposed to. And the reason it is not a problem is because it doesn't cause a problem. People love to make problems out of things that, aren't necessarily problems, especially with children. But I digress, and I will discuss that more. But neurodivergent is a term that encompasses a vast spectrum of brain functioning. Some neurodivergent traits may be subtle, while others have a more significant impact on behavior. And so the term neurodivergent describes people whose brain differences affect how their brain works. It's not a medical term, but it is a way to describe people using words other than normal and abnormal. Okay. And I think that's really important because truly, as someone who's practiced for over 25 years, I come from an interesting dynamic that was a sociological experiment before that. And, I'm a human that lives in the world. And so what I'll say is that society wants things to be in two buckets, and that's just not how it is. And if it's not in a normal bucket, then it gets put in this other bucket of like just hurtful stuff. And so that's just nonsense. And that's just because that's how society works. That doesn't make it right or accurate or true. But the important thing that I wanted to note here is that just like a person's fingerprints, no two brains, not even those of identical twins, are exactly the same. I'm going to repeat that. Just like a person's fingerprints, no two brains, not even identical twins, are exactly the same. Why is that important? If you are looking at two identical twins and they are identical in every way, shape, and form, which, I mean, usually for keen observers, there are small differences, but even when there's not, their brains are different. And I need people to understand that because sometimes, society is very blind to what's called invisible illness. I'll explain what that is. Invisible illness is an illness where something is going on, but you can't see it on someone's person. So, for example, my looks gaslight me all the time. I look amazing, but I have a chronic cancer. I've been doing treatment for 5 years, and I have 1 million health problems. And a lot of days I feel terrible, but I will look totally fine. There's times where I need to use mobility aids and there's times where I don't. So sometimes if I'm using a cane, I will get treated differently than if I am not using one. So with neurodiversity is that some folks on some of these under the umbrella of neurodivergence, you can't always tell. It's not something, people don't wear it on their shirts or have, billboard signs that they're carrying around. And my point is that, unfortunately, sometimes when we can't see or we can't tell that there's an issue, it leads to stigma, it leads to judgment, it leads to lack of resources. It leads to, being victim to gender roles and misogyny, which I will explain is that in some of these neurodivergent disorders, there are such huge gender differences that it's absolutely mind-boggling. So, let's just get into it. So I wanted to start that off with this all. There's no definition of normal capabilities for the human brain, and neurodiversity just allows a more compassionate and educated approach. So, if you're a specialist and this is not your approach, please, that's okay. The whole point of this is that we all do things differently. And so, there's room for all of us at the table. So let's start with some of the most common conditions associated with people who describe themselves as being neurodivergent. Okay. Number one, ADD, ADHD. So attention deficit disorder, attention deficit hyperactivity disorder. Then we also have autism spectrum disorder, which includes what was once known as Asperger's syndrome, which the reason we don't use that anymore is because Hans Asperger, who the syndrome was named after, we found out was a Nazi. I share that information because it's just really important that we don't use the term Asperger anymore. And that is why. And so I share that because then people will be like, oh, okay, we're not going to use that. And plus, that's not the only reason we don't use that term anymore. But what scientists and psychologists and neuropsychiatrists have realized is that autism spectrum disorder, it's a spectrum. There's not two different types. It's being, as with all psychiatric disorders across history, we can't do better till we know better. And so now we know better about the spectrum of autism that was kind of miscategorized in ways previously in the DSM, which I'm going to talk about that. In addition to those disorders, we also have dysgraphia, which is difficulty with writing, dyslexia, difficulty with reading, dyspraxia, difficulty with coordination, and other conditions that fall under the neurodiversity umbrella are Tourette syndrome, dyscalculia, which is difficulty with math, which, by the way, I was treated like I was dumb my whole life because I was bad at math. And I'm pretty sure I actually just had dyscalculia. I had no idea that I had all these other gifts and knowledge and talents. And so thank goodness that I found it. But other conditions that fall under the umbrella are also Down syndrome, epilepsy, certain chronic mental health conditions like bipolar disorder, obsessive compulsive disorder, borderline personality disorder, anxiety, and depression. The last thing I want to say here is that the role of COVID cannot be left out of this discussion. Why is that? When I had COVID, first of all, it did almost kill me, which maybe I'll tell that story at a different time. Second of all, when I had it, my brain, I cannot explain to you how my brain felt, just like a chemically feeling. And I've talked to other folks about this too, and they've reported similar experiences. And after COVID, my brain felt different in ways that I am aware of, but I cannot even completely understand. So I'll give you an example. Before COVID, I didn't tend to have attention deficit issues. I would go to complete a task and I would complete that task. Now I go to complete a task and I think to myself, okay, but to do this, I have to do this. And to do that, I have to do that. And to do that. And so from what I understand, people right now who have like ADD or ADHD are like, oh, hi, welcome. That's me. That my brain now, it just works differently. And so the problem with COVID is that COVID, we know medically, had extreme impacts on folks' memory, their brain functioning, their lung functioning. And the problem is because it was still semi-recent, studies, it takes time to do studies. You need participants, you need, to do trials, you need to do all these things. And so COVID is still a relatively new phenomenon. And I believe that once more research is done, we will find a host of folks who developed multiple mental and physical health conditions as a result of COVID. I do believe that. So that's just something that I wanted to put out there. But for now, let's talk about ADD and attention deficit hyperactivity disorder. So ADD or ADHD is a neurodevelopmental disorder that can affect children, teenagers, and adults. Okay. All different ages experience it differently. So different genders, different ages, it's experienced differently. But generally speaking, the most widely accepted theory of ADHD is that it is a dysfunction of dopamine, which is a key neurotransmitter in the brain. But the brain of a person with ADHD develops differently than a typical brain, which can impact a ton of things: their attention, ability to sit still, and self-control. There are literal brain differences in these folks. So, slower development. The brain of a person with ADHD develops more slowly, especially in the prefrontal cortexes, which controls attention and impulsivity. And so this is going to gobsmack some people, but I always talk about on my podcast how the last two parts of our brain to develop are those prefrontal cortexes, which they control a lot of things. Impulses is the main one. I've talked about on my podcast before how that does not develop until the age of 25. And so when you're seeing someone in their 20s still behave very much like a child, it's because they are, and society is the problem. We're saying these people are adults, and it's like, no, man, they're not. The research is here. It's just, what do we do with the research? And what society does is they say, no, we're going to ignore that, and we're just going to gaslight the hell out of people. And I'm like, well, okay, I'm not going to do that. The point is here that people with ADHD, there are studies that show that their brains, those prefrontal cortexes, do not finish developing until the age of 35 years old. So I hope, to anyone listening to this who is a person who's dealing with this, whether you're a patient or a caregiver, I hope you feel all the way validated, because that is the honest truth. That is backed by science, backed by research, information that we did not know before. And so if you're someone who's dealing with this and you're like, well, why am I slower to develop? Well, it's literally your brain. It's literally your brain. It's like being born with, a genetic disorder and people being like, just work your way out of it. And it's like, well, no, that's not how that works. So I'm sorry that people listening to this have been gaslit for so long, and I hope I provide a lot of validation. The brain of ADHD so there's slower development, as I mentioned. There are smaller brain structures. So some structures like the prefrontal cortex, cerebellum, hippocampus, and amygdala are smaller in people with ADHD. Motor cortex maturation. So the motor cortex may mature quicker than usual in people with ADHD. So that relates to symptoms such as restlessness and fidgeting. And then in a meta-analysis of childhood ADHD studies find decreased fractional anastrophy, it's called FA, in white matter tracts that link cognitive control and attention cortical networks. All right, so what does all that mumbo jumbo say? And it's important mumbo jumbo, let me be honest. But what it says is that you're not making this up. There are legitimate differences that can't be seen, that are invisible. Well, until, you actually do like the brain studies and imaging and things like that. But this is not all in your head. Okay. So some facts and statistics about ADHD and ADD is approximately 5% of adults have ADHD. That represents over 11 million people in the US. It occurs in both men and women. And of course, it appears in folks who are non-binary. So it's irrespective of gender. But again, studies aren't always as progressive as they should be. ADHD usually persists throughout a person's lifetime. It's not limited to children. It's a neurobehavioral condition, so there's no cure. Some people do outgrow it. Approximately 2/3 or more of children with ADHD continue to have symptoms and challenges into adulthood that require treatment. And so for some people who grew up with this as a child, they may have grown out of it. But for those folks who didn't, and they got diagnosed at a later age, this is why. It's because, especially if you were a woman, I'm going to explain definitely why that happened. While initially research was focused on studying hyperactive school-aged boys, we now know that women also have ADHD, which is such a wild statement that we could have even thought that girls didn't experience this. So here we're going to start to see some gender role problems and some serious misogyny, is that because boys and men statistically are more likely to be referred for testing, treatment, receive accommodations, and participate in research studies, which makes it hard to identify the ratio of men to women with ADHD. Some researchers have suggested that ADHD is more prevalent in men, but actually we are learning this is likely not at all the case. ADHD in women is consistently underdiagnosed and undertreated compared to men, especially those who do not demonstrate hyperactivity and behavioral problems. Okay, let me be clear about what this means. Misogyny is everywhere. Our society is patriarchal. It is based on misogyny. I cannot tell you how many times I have been brushed off as a hysterical woman only to be diagnosed with cancer twice and a plethora of other autoimmune conditions that got ignored because I was treated like a hysterical woman. But my anger with this is that girls present differently than boys do. And so boys present in ways that get them the help that they need. Girls are better at masking. And so they go through their whole lives being gaslit and not given the resources they need or being told to just be smarter, do better. And in reality, their brain dysfunction is completely being missed because they don't present loud, aggressively, or behaviorally like boys do. Because what our society likes to do is they say, well, this is only a problem if you're behaving like it's a problem. And so it's a problem because, well, you're disrupting the classroom. It's a problem because you're driving your teachers crazy. It's a problem because you're driving your parents crazy. And it's like, oh gosh, society is so wild sometimes. But I digress. ADHD treatment, research has shown that the most effective treatment for ADHD is a combination of medication and therapy. Medication manages brain-based functions and symptoms, while therapy addresses the daily thoughts, behaviors, and coping strategies. Because make no mistake, when your brain is different, you do need the strategies to assist with problem solving, time management, getting accommodations for if you do have some issues with reading or writing, to get those accommodations to assist in making those things easier. I used to work at a college, and one of the main issues that I help people with is people who needed accommodations but weren't really getting them, helping them get those accommodations, and then helping them understand how to manage skills. And it did open my eyes a lot to the role of, Americans with Disabilities Act and accommodations in schools and things like that. And so what I want to say that there's 3 different types of ADHD, inattentive, hyperactive, impulsive, and then combined. So it can be one or the other or both, but it is important to note that since symptoms can change over time, presentation changes over time too. Again, what I'm going to say 1 million times is that we are all so different. Our brains are all different, and that's okay. And so, just to remove the stigma of whatever you are presenting with, that's okay. It's what you're presenting with. Various contributing factors that play a role in development of ADD and ADHD, including chemical and structural differences in the brain, as well as genetics and environment. So what does this mean? Epigenetics. People who have listened to this podcast for a long time have heard me talk at length about epigenetics. Epigenetics is where genetics and genes meets environment. And here's why it's so important to understand how diverse epigenetics are. Imagine same siblings grow up in the same house, but experience wholly and completely different family dynamics in different childhoods. So let's just use that as an example for epigenetics and why it's so important. Is that these 2 siblings may have similar genetics, but epigenetics tells us that a gene may be turned on, kind of like a light switch, based on environment. So if you're neglected, if you're abused, there are certain genes that may click on regarding substance use disorder and things like that. And then that explains why one sibling struggles with that and the other siblings do not. It's a very complex topic. It is in its infancy in terms of what we understand and know about it, but it is one of my favorite things to talk about because, again, it just goes to support the neurodiversity idea that really we're all so unique, and what we've been made to believe is not true. Okay, now let's talk about autism spectrum disorder. By the way, everything I've said so far has been through Attention Deficit Disorder Association online. I am happy to cite my resources so that people can go ahead and do their own research. So some of it is from my personal experience, working with clients who are neurodivergent and neurodiverse. And some of it is going to be straight from the source, from websites. So speaking of autism spectrum disorder, my resource for this was Autism Speaks, one of the best resources to gain information and up-to-date research and studies and things like that about ASD spectrum. Okay, so first we're going to talk about the question that has been roaming the internet. Who the heck is qualified to diagnose autism spectrum disorder? Okay. A qualified medical professional or licensed psychologist can diagnose autism spectrum disorder. Now, more specifically, it should be diagnosed by someone who is a psychologist or a psychiatrist. There are many people who can be involved in the diagnosis process because, as I mentioned, it does take a village when you're dealing with autism spectrum disorder. So there may be many people involved in that process. So a therapist, let me be clear, a therapist is a generic blanket term for a master's level clinician. Okay, so I'm a master's level clinician. I have a master's degree in clinical psychology and have a license. I'm a licensed professional counselor. Okay, I'm not using my license in this capacity, but that is my credentials. So in the state that I live in, Pennsylvania, a licensed professional counselor, LPC, and a licensed clinical social worker, LCSW, may be able to conduct an autism evaluation in adults if they have specialized training in autism and psychological assessments. However, not all mental health professionals have the expertise or training to diagnose autism. So a qualified healthcare professional such as a psychiatrist, psychologist, neuropsychologist, or neuropsychiatrist is best to diagnose autism. An LPC or LCSW can be important in the process because if they're seeing the client, so for example, I'm an LPC who I've worked with people on the autism spectrum and who are neurodivergent. My role with them may be helpful in getting them to the proper channels to get diagnosed, but it would be unethical for me to diagnose someone because that is not my specialty, that is not my purview, and that is not my training. However, I may be able to say, so I'm hearing you know that you're experiencing sensory issues and difficulty, with social interactions and things like that. Okay, so let's explore this. Let me help you tease some of this out. And then let me point you in a direction where we can get you an accurate diagnosis. That's how I would have approached the situation. Okay. But all professionals are different. And some people do act out of their scope, number one. And number two, technically, in the state of Pennsylvania, when I was seeing people, I had to diagnose for insurance purposes. So if people are saying that you cannot diagnose if you are a therapist, that's not true. If people are using their insurance requires a diagnosis. And so again, what I would do in this situation, if someone came in and they are saying, I think my child is on the spectrum, but we're starting from scratch, I would do the assessment, gather the information, and then refer to colleagues who were trained in identifying it. However, what people miss is the part of the insurance process, right? Where insurance is only going to pay for something if you have a diagnosis and then there's a treatment plan that you're working on that diagnosis. So there may be times where a master's level clinician is giving a diagnosis of this so that insurance will cover it what I'm telling you is that it's not just black and white and there's shades of gray. So I'm not going to say it's never appropriate, but I'm going to say that it's probably only appropriate in certain scenarios. Other people involved in the diagnosis process are school psychologists. They work with students in schools, clinical psychologists, neuropsychologists that study the relation between the brain and behavior. And then there are neuropsychologists who are just for research, and then clinical neuropsychologists who further specialize by focusing their work in working with conditions like autism spectrum disorder in the field. There's also developmental pediatricians who have advanced training in developmental and behavioral medicine. They evaluate, counsel, and provide treatment for children, adolescents, and their families. There's pediatric neurologists, child and adolescent psychiatrists. So you understand what I'm saying here is that it's a multidimensional and very complex process to get a diagnosis, and it really does take a village. Now, what I will say is there are testing that you can use to assess. Psychologists who specialize in diagnosing and treating individuals on the autism spectrum should have experience using a psychometric evaluative measure, which is a fancy word for a test, including the ADOS-2. ADOS-2 is a play or conversation-based assessment tool in the situations that I just said for individuals who traditional testing is going to be a setup for failure. Okay, so that is a legitimate, important test for people to get done. And then the ADI/R is a caregiver interview. So these two tests, when used together, are the quote unquote gold standard evaluative measures to diagnose ASD. Now, adults with ASD may be referred differently than children with ASD just due to the nature of, a million factors. Children, adults may have more insight and awareness and are able to advocate for themselves when children, they need their parental caregiver, whoever is raising them, to do that. And again, in adults, other caregiver information should also be used. But, I'm just saying that there's some differences here. But diagnosing ASD in adults can be more difficult than in children because some symptoms can overlap with other mental health disorders, number one. And number two, people as adults who are used to masking and just pretending and trying to get along have done it so well that it's hard for them to get out of that. Let me talk about autism. Autism looks different for everybody, and each person with autism has a distinct set of strengths and challenges. Some autistic people can speak, while others are nonverbal or minimally verbal and communicate in other ways. Some have intellectual disabilities, while some do not. Some require significant support in their daily lives, while others need less support, and in some cases live entirely independently. And what I want to identify is that there's so much grief in this. I can't wait to have my friend Kathy on to talk about this because her son is nonverbal. And I imagine that watching people live with autism spectrum disorder so differently comes with its own complex grief challenges. Some parents will have to be a caregiver for their child for the rest of their lives, and while watching other children on the spectrum live independently. And so I just want to say for people listening to this, if this resonates with you, I see you, I hear you, and I just send you all the love and support in the world, and you're not alone. Autism or autism spectrum disorder refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and nonverbal communication. But the two core autism symptoms are number one, challenges with social communication and interaction skills, and number two, restricted and repetitive behaviors. Restricted and repetitive behaviors vary greatly across the spectrum. To get an autism diagnosis, a person must show at least two types of these behaviors. So repetitive movements, play or speech patterns, stimming or making repetitive body movements to regulate emotions. So for example, rocking, hand flapping, spinning, running back and forth. Also, something common that happens is called echolalia, which is imitating another person's speech, repeating words or phrases. And so one of my main beefs with the information that was out there after Tamara's diagnosis is the incorrect belief that people on the autism spectrum or people who are neurodivergent lack empathy. That couldn't be further from the truth. Fire is coming out of my mouth right now. People who are neurodivergent often, I would argue, feel things more deeply than the average bear. They just express it in ways that are considered non-traditional by society. And even people who are nonverbal, they experience emotions deeply, as evidenced by stimming, which is, really a repetitive body movement to regulate emotions. And so they wouldn't be doing that if they didn't feel the emotions. Okay. I just have to be really super duper clear about this. Okay, some statistics. According to the Centers for Disease Control, CDC, autism affects an estimated 1 in 36 children and 1 in 45 adults in the United States today. So obviously, folks who are listening to this in other countries, there are whole other different statistics for different countries. I'm happy. Listen, if anyone wants me to look at that and report that, just let me know what country you want me to look at and I'll beep, boop, beep, boop. I'm happy to do it. On average, autism is diagnosed around age 5 in the US, with signs appearing by age 2 or 3. Current diagnostic guidelines in the TSM-5 revised edition break down the ASD diagnosis into 3 levels based on the amount of support a person might need. Okay, so there's level 1, level 2, and level 3. And I'm going to discuss that more in depth when I have Kathy on the show, because I want to be really mindful about how I navigate and discuss that. But going back to the gender differences, is that research shows that autism in adult women and girls can look different, as I mentioned. But according to the DSM, the American Psychiatric Association's most recent diagnostic manual of mental disorders, including ASD, autistic girls and women may present with better reciprocal conversation skills. Women are just naturally more social. And so that leads to misdiagnosis. Also, higher likelihood of sharing interests with others. Women tend to be more social and connected, and which again, I think is societally based, but that's a whole other thing. Women and girls are better able to understand verbal and nonverbal communication. So in other words, they're empathetic sensors. They can read people's emotions and understand the subtext of things going on, even with autism spectrum disorder at times. Women and girls have better ability to modify their behaviors based on the situation, which is just like such generational trauma and BS, which is like, to be like a good girl, you have to just like have no problems and just like be perfect. Sorry. I'm having one of those days. And so my sassy part is really coming out today. But I also just have no tolerance for this stuff. So, I mean, you get it. So women and girls have less obvious repetitive behaviors, which I just think they're better at hiding them, and more socially acceptable interests like celebrities or animals versus boys who their interests may be deemed as like strange or concerning. Other facts here is that many people with autism experience other medical, behavioral, or mental health issues that affect their quality of life. Health conditions like seizures, chronic GI issues, sleep and eating issues, mental health conditions, and others frequently accompany an autism diagnosis. And Autism Speaks, by the way, funds research to better understand these conditions to help people with autism lead fulfilling lives. So among the most common co-occurring disorders with ASD spectrum is attention deficit hyperactivity disorder, anxiety and depression, gastrointestinal disorders, as I mentioned, seizures and sleep disorders, which I mentioned. But another one, which is interesting, is Fragile X syndrome. 30% of folks with Fragile X syndrome also have a diagnosis of autism spectrum disorder. And here's why I'm mentioning this is I went to go get my car serviced, and dealership that I go to, there's this one woman there who I just adore. Like sometimes I meet people and I just feel really drawn to them and I don't know why. And so we've been friendly for years. And I was telling her about the drama that I was involved in and this podcast. And she said, I have Fragile X syndrome. And I said, and I gasped, and she said, you know what that is? I said, I do. And I explained why I know what it is and how I know what it is and how I know that it's related to autism spectrum disorder. And we talked about, she said, I am on the spectrum and I also have this disorder. And I said, no wonder why I adore you. My people, you're my people. My people are neurodivergent, neurodiverse people. My people are the warriors, the wounded, the black sheep, the cycle breakers, those who have been crushed to dust and who've come back. And those are my people. And so I am proud to know her and, grateful that in that moment I could be one of the few people to hear her, to listen to her, and to actually understand what she was dealing with. I could tell that really validated her. So I'm really grateful for that. So going back to these gender differences, is that research from the CDC says that boys get diagnosed with autism 4 times more often than girls. And again, because it's all of those, not only is it all of those differences, but their symptoms also go unrecognized by doctors and, misogyny. And as I mentioned, it's harder for adults to learn to mask or hide their symptoms. To be diagnosed with ASD, an individual must meet all 3 of the following criteria. And here's the thing. Okay, I went back and forth about should I discuss this. So what I'm going to say is I will give this criteria, but provided that no one listening to this is self-diagnosing. That I just want to say that that's really... It can lead to self-judgment and shame. And so listen, if anything that you are listening to this on this podcast is resonating with you, there are online tools, online like tests that you can take to get clarity about your symptoms so that you can then take them to the proper channels. If you have any questions about any of that, please go to Autism Speaks to find resources for practitioners in your area. You can also go to psychologytoday.com and you can use a filter to look at someone who specifically focuses and is a specialist in this area. To be diagnosed with ASD, an individual must meet all 3 of the following criteria. 1, difficulties in social emotional reciprocity, including trouble with social approach, back and forth conversation, sharing interests with others, and expressing and understanding emotions. 2, difficulties in nonverbal communication used for social interaction, including abnormal eye contact and body language, and difficulty with understanding the use of nonverbal communication like facial expressions or gestures for communication. 3, deficits in developing and maintaining relationship with other people, other than with caregivers, including lack of interest in others, difficulty responding to different social contexts, and difficulties in sharing imaginative play with others. This goes beyond introvert or extrovert. Okay, this goes beyond that, because what I don't want to pathologize is the fact that all children and all adults have different levels of social interactions and social batteries. Okay, so there's some of this that is not pathological. I'm just describing the part that they say does cross over to pathology. The latest edition of the DSM, the DSM-5, made significant changes to the diagnostic criteria for autism and related disorders. So in the DSM-4, there were 5 separate diagnoses classified under the heading pervasive developmental disorders: autistic disorder, Asperger's syndrome, pervasive developmental disorder, which is called PDD, Rett syndrome, and childhood disintegrative disorder. Now, the pervasive developmental disorder category no longer appears, and autistic disorder, Asperger's syndrome, and PDD have now been combined into one label, which is autism spectrum disorder, which again, I believe comes from we can only do better once we know better, and we now know it's really more of a spectrum of things rather than different categories. So regarding testing, there is no medical autism test like a blood test to diagnose autism spectrum disorder. Instead, a multidimensional approach, including experienced medical professionals, examining a person's developmental history and behavior, interviewing and observing the person and their loved ones, and using a professional screening and diagnostic tool to make a diagnosis. Psychometric evaluative measures, including the ADOS-2 and the ADIR, when used together, are the gold standard. And while an autism diagnosis can only be given by a healthcare professional, there are several screening tools that can alert parents, caregivers, and autistic people to potential autism symptoms. Screening tools, as I mentioned, are not diagnostic. Whew, that was a lot. So I just want to, the thing that I want to circle back to is that sometimes these disorders are invisible and only increases the stigma and societal judgment. So what I hope to have done today is done right by every single one of my neurodiverse listeners listening to this, who again, I want to say I qualify in that because I have a diagnosis of complex PTSD and major depressive disorder. However, I'm not going to say that I understand because I understand my experience. But I want people to understand your experience. And I want to do right by all the people listening, by all the people who felt unheard, invalidated, misunderstood, misjudged. I hope that today I have set the record straight. I cannot wait to have my friend Kathy on to discuss some of those specific differences with the levels of support that some folks with ASD need. And I'm just really grateful to be able to share not only my experience, strength, and hope, but also my type A research driven psychoeducation. And I've just loved every second of this. So, and to all the new listeners who maybe came for the drama and are staying, thank you. Welcome. Glad you're here. Stay tuned for, more. I got some stuff cooking with, Mandy Slutzker. I am definitely going to be talking about some housewives coming up. So, and of course, I will be continuing to serve bite-sized bish. So for today, I'm going to say thank you for listening. Please take care of yourselves and each other. And ta-ta for now. Disclaimer. Posts are not intended to diagnose, treat, or provide medical advice. Your Bish therapist is for entertainment and informational purposes only. The podcast, my opinions, and posts are my own and not associated with past or present employers, any organizations, Bravo TV, Greyheart Productions, or any other television network. The information in YBT podcast and on its social media is provided for general informational purposes only and is not intended to diagnose or treat. Please do not act or refrain from acting based on anything you read, see, or hear on YBT podcast or associated social media. Communicating with YBT via email and or social media does not form a therapeutic alliance. Melissa, operator of YBT, is unable to provide any therapeutic advice, treatment, or feedback.